When you come in with PTSD, you may see a psychiatrist, you may see a psychologist. I am a psychiatrist. Psychiatrists are MDs, medical doctors. Primarily, my role as a psychiatrist in the clinic is to prescribe medications that can help relieve symptoms of PTSD, depression, other anxiety symptoms. Psychologists are also doctors with PhDs, and their role primarily is to provide psychotherapy for PTSD. When you come in and see a psychiatrist, if you and your provider decide to prescribe medication for PTSD, you will probably only see your psychiatrist on a monthly basis or every other month, depending on how often you need to be checked on to see if the medication needs to be adjusted. When you see a psychologist to do therapy for PTSD, you typically will see that person every week for an hour or more, depending on the type of therapy that you're doing. And generally, that therapy will last about 3 months. Often I draw the analogy to physical therapy. When you have a physical injury, you may be referred by your doctor to do physical therapy, and you would work fairly regularly on a weekly basis, for example, with a physical therapist to work on your strength and range of motion and to recover from the injury. Therapy for PTSD is similar in many ways to that, in terms of working closely with a psychologist to overcome some of the difficulties that you may be experiencing.